We've looked at the tibiofemoral and the superior tib-fib joint. That leaves us now with the patellofemoral joint. And this joint is quite complex in the causes of the problems here and also in some of the treatments. So we're going to keep this quite simple and treat it as a joint, examine and treat it just as another joint, rather than getting into all the business about patella tracking and so forth. So the mechanical examination of this joint will involve mobility tests and stability tests, the same as it does everywhere else. But we will also have to add in a compression test to test for irritation of the retropatellar surface. So looking at mobility, we can test this simply by taking the patella and gliding it from side to side. Medial and lateral glides, and we can test superior and inferior glides and medial and lateral rotational glides left and right. This will give us some idea of how mobile this bone is. We can also stress test, and the restraints to this are many and include dynamic restraints such as the quadriceps and also passive restraints such as the retinaculi that attach the patella to both the femur and to the IT band. So we can take the patella and stress it laterally by doing the lateral glide, but trying not to let it tip as we do so and just producing that lateral stress. And the same medially. And these two tests will tend to test the horizontal bands of the lateral medial retinaculi. To test the more vertical bands of these retinaculi, we can take the patella and tip it. So we can take the medial aspect and try to lift it straight up from the femur. And in order to do this, you have to get your fingers underneath the patella and tip it like so. So it's that, which will test the vertical bands on the medial side, and to test the vertical bands on the lateral side, we will tip it in this direction, like so. And like all stress tests, we're looking for reproduction of pain and any excessive mobility here. When we're looking at retropatellar irritability, we can use the compression tests. And Clark's test, which is an old test and isn't done very much, and I'm sure Beverly will be pleased to know I'm not going to do it on her, is where you actually put your hand over the top of the patella above it and get them to contract their quadriceps so the patella slides up underneath your hand and scrapes against the femur. Now, even in normal subjects, this is extremely painful, and it really should only be used as a last test when everything else is proven negative, but you're sure there's a problem ongoing. We can do a little bit more of a gentler compression though, looking at the inferior, middle and superior facets and looking for any irritability here. So what we need is to get the knee somewhat flexed so that the inferior facets of the patella are actually in contact. So it's a little low, but maybe around about 20 degrees. I'll get the other sandbag just to get it up where it belongs. So we've got the knee flexed to about 20 degrees. That should be enough to tip the patella and bring the inferior facets onto it. So from here I can simply compress down on the patella and grind it from side to side with my left hand, while the right hand stabilizes the femur. To compress the middle facets, I'll just pull the femur down the leg a little bit and then compress and grind side to side. And for the superior facets, pull it all the way down as far as it will go and then grind from side to side as I compress down on the patella. The lateral medial, or the odd facets, will be compressed with the knee in full flexion, like so, and I'll come onto the medial side of the patella and grind the medial side down against the patella here, and do the same for the lateral side, like so. So I'm grinding the patella down. I'll show you on the other knee so you can get a good all-round view on this. So again, with the knee in full flexion, the hand will come onto the lateral side of the patella first, and I'll push down and grind it, and then do the same on the medial side, push down and grind. As far as treatment of the patella is concerned, there's a whole gamut of treatment, and you should be looking at the causes, which ranges anywhere from a spinal problem through to a foot problem. And detecting this cause is one of the great challenges in manual therapy. But local treatment includes such things as resting the knee, either by having the patient avoid the activity or by taping. And you can use these grinding techniques, if you're careful, to actually improve the pain in that area, but it's got to be done very carefully. And essentially what you do is you simply grind up to the area quite lightly, and you work around the painful area without actually inducing pain. And gradually, as you do this, the amplitude of the grind can be increased so that you work more and more into the pain. But it's got to be done very carefully, otherwise you'll flare the joint up. And of course then you'll have to work with the quadriceps, re-educating the quadriceps with the hamstring stretching out so that they have full extension and so forth. This is not one of the easiest joints in the body to treat, the reason being that the causes of problems in this joint are myriad. So good luck with it.